Hi, everyone. Jen Lamia here. I will admit that I woke up the morning before Thanksgiving on that Wednesday, and I just had the biggest smile on my face. I just cannot believe we are still in school. And I am so happy. When we were doing all of this planning day and night and weekends over the summer, the administrators who are on this call and I, our administrators at Wampus and at Coman Hill, and I know Jill's on here, our special ed director. Of course, Tim and Gina are on here from the district office. Um, we never, we didn't even know if we were going to be in September, right? We just plowed forward with the plan to get every K-6 kid in here every single day, knowing how important it is for them to have that in-person instruction and setting up remote instruction for the kids who were truly going to be remote for that entire time. I'm really proud of the work that everyone's done. And I'm also really proud to be in a community where people are so supportive of this work. I can't tell you how much it fuels us, because this is killer work that we're doing right now, and knowing that the only type of negative comments I'm getting back, I'm not getting negative comments. I'm getting, this is working well, continue this. We could use more of this. My kids are really engaging in this way. Is there any way that this can be expanded upon? I mean, it's really such a positive climate to work in with this parent community. And I have to say how much we appreciate that. We appreciate the confidence that you've had in us to do this. It is our mission, right? This is our calling. This is our service. This is what we do as public educators and as public administrators. Our goal is to educate your children and care for them and love them. And we were being called to a duty right now that was more than anybody expected in their professional and personal lifetimes. But I have to say that your teachers, your administrators, and we do it with joy. It's hard, but with joy. Your children are absolutely amazing. All I love seeing was those little Coman Hill kids coming out with their turkey hats on the day before Thanksgiving and getting into the cars, and, you know, kids sharing the work that they're doing in their classes at both buildings. I happened to be emailing with a mother last night. I know the elementary boy at Coman Hill, and I never even made the connection that this little girl that I met at Wampus who was sharing her story with me is his brother. And, you know, that's why I work here. This is a community, and we're so happy to be with your kids. So that said, we have to think about, how are we going to get from here to the bridge over toward the end of COVID? We hear things in the news right now that give us some hope. We hear about the CDC understanding more about the quarantine periods and maybe potentially being able to reduce these quarantine periods and the restrictions on quarantine. We know we've seen some new things with travel, all of this kind of helping us to navigate the COVID landscape. We also know that the FDA has recently approved an at-home rapid PCR self-administered test, right? So that, with its FDA approval, we're hoping to see its availability at some point. We know that New York State is looking at schools and saying, how can we keep schools open? This is a priority for us. And so they are looking at testing to say, how can we test a certain percentage in order to keep our schools functioning? We know that they are telling us that these transmissions are not happening in school. We're not seeing evidence of it, but I will tell you something. It's a little deceiving. It's like tracking the common cold. I don't know when a father has COVID, so the kid has to stay home, if the kid actually brought that COVID home. I say there's no in-school transmissions, but nobody knows that for sure. What we are not seeing, though, is a student and another student who is sitting in the class who are not friends transmitting to each other. So that's important. And we're not seeing a student in a class and then another student and a teacher in that class getting COVID. That's the level of transmission that we're talking about. So all of those are very positive thoughts. So how are we going to try to continue to stay in school for the rest of this school year? And how are we going to navigate the landscape from right now, where we're not testing, through a testing period, to a vaccination period, and to whatever normal life is going to be like at that point in time? So I'm going to share my screen. I have some slides just to give you a bit of an update about where we are. I'm going to start there. And Tim Kaltenecker, or can you just tell me if you see my screen right now?
Yes, I do.
And I will minimize everybody. Okay. So just to give a little bit of an update, I met with all of the faculty at faculty meetings over the course of the last couple of days to do a similar update, and I will be meeting with the stakeholder group this afternoon to talk specifically about this and about testing. Oops, sorry. So let's start with the state of our schools. Saturday, September 1st to December 3rd. Where are we in this COVID landscape? So we have 26 students or staff at this point who have been COVID positive since the beginning of school. That's out of our 2,703 in-person individuals, which actually is less than 1%. We've had 14 resulting quarantine situations. And as I said, no known or suspected in-school transmissions. But when I say that, I've sort of explained that out. To say that you have no in-school transmissions is a naivete, which we are, not going to. The next is, what has our attendance been looking like? This is for Coman Hill. And if you take a look at the expected and then the actual, let's start looking from November 30th. These are not huge numbers of kids who are not in school. Now, some kids are staying home because of family situations. You can see the number of kids who are remote, but we are standing pretty strongly with our enrollment in both Coman Hill and even in Wampus. You'll see that the enrollment is about what we would expect for the number of kids who are expected and the number of kids who are actually here. That would be expected during this time. Where you see a little bit of a difference is when you get to Crittenden and when you get to the high school, and not necessarily for grade 6, but because grade 6 is still pretty much in force, but grades 7 and 8, remember we do have the cohort. So while we're expecting 83 on the 30th, we are getting 60 kids. So you're losing out on about 23 kids in the 8th grade on that day. Some families who are choosing to keep their kids remote. And as I said from the beginning, every family situation is very, very different. You have to do what is best for your family when you are trying to keep your child remote, either at a middle school or high school level, or asynchronous if you're going to be doing the K-5 piece, if you're not in a quarantine. And that is a family choice that you have to make. And I want you to make those choices with permission. I don't want you thinking, well, my child is going to be, if I take them out for the next week, which I'm not encouraging, I'm encouraging kids to be in school, but I'm respecting your family decisions that you have to make. If the child has to be asynchronous for a week or two, we're going to work together, right? Your child will be fine. You have to make decisions that are best for your family. I do think that if your family situation supersedes the school situation, you will make that choice. And if not, your schools are here and ready and open for your kids. I'll skip over the high school sign. It doesn't really matter. So what is our plan moving forward? Everyone wants to know, when do we have to close schools? And I love a few people who emailed me directly and asked me to call them and said, I just want to know, is your plan to keep schools open? My plan is very much to keep schools open. I think schools are safe places for kids to come. I think that we're going to be exhausted by the quarantines that we occasionally have here and there, and we'll start to see things creeping up after the Thanksgiving holiday. But our goal is to keep kids and teachers in schools, in classes, and learning together. So what about these zones that the governor talks about? Yellow, orange, red zones. And what about testing at Byram Hills if we go into those zones, or just testing in general? New York State zones, you'll see the red, the orange, the yellow zones. If you go all the way down to the bottom, it says schools. If we are in a red zone, all schools have to be closed. If we're in an orange zone, it says closed and remote only. But we do have, and we are expecting new guidance about the fact that we can stay in school in an orange zone. I'll share that guidance with you on the next page. And a yellow zone, they've changed the amount of testing. So if you look at the red, schools, and this is from the New York State Center for School Safety. As part of this, schools located in orange and red microclusters will be provided to conduct weekly testing. Schools in orange zones will be required to test 20%, and that is over the course of a month. Schools in red zones, 30% over the course of a month. So essentially what the governor is now changing this to, he's saying you don't have to be remote only. You have to have a testing protocol in place to stay open. Now, we are, the Board of Education and I have been working on this. I have been collaborating with Bob Shaps from Mamaroneck. We've been doing this work together. He and I have interviewed at least 24 companies about the types of testing that they do. We understand that New York State is going to actually give out free tests. So we have some schools in zones right now. Ossining is in a yellow zone, parts of Ossining. Portchester is in an orange zone. And New York State actually issues rapid tests. They are not PCR tests. So what's happening is these free tests are coming to schools. Schools are having people in their employ trained to do these anterior nasal swabs. They're conducting full testing at schools, just like you go to when you drive up to the Westchester Department of Health, schools are conducting those exact same things. And then the rapid results, although they're rapid, it takes 15 minutes per test to go through a machine. So you know nothing's rapid and nothing's free. And they are just the rapid tests. They're not PCR tests. So they're not as effective as the PCR tests, and they do have a lot of false negatives. So why conduct COVID-19 tests of students and staff? We want to get into a testing system right now that will enable us to move through yellow, orange, and red zones, should our school ever get put into one of those zones, and remain open by showing that the number of people tested is less than the percentage of people tested and positive in Westchester County. And I believe that we would definitely meet that metric. So why not just use these free New York State tests? Why go out and look at these other companies? I don't want to swab your 5-year-old's nose. I don't want the school nurse to swab my nose. I want a PCR test. I don't want a rapid test that may or may not give me accurate results. So the Board of Education was in support of me looking at different companies with my partner over in Mamaroneck. And what we settled on is a company called Miramis. They do saliva PCR testing. This test means that your child will be sent home if we have to do 10% per week, if we have to, or once we get that together in January. It means that staff members and students, 10% of them who agree to the testing, will be sent home with a tiny little vial. Our nurse will be the only person that knows that your son or daughter's vial 6699 is connected to your child. We will send the vials to Miramis in Brooklyn. We will drive them over there, and within 24 to 48 hours, we will have PCR testing done for the percentage of kids. So we're getting accurate tests, and we are using a saliva method. Now, my kids did the saliva method last summer, and last summer, my 19 and 20-year-old spent like 45 minutes spitting into an enormous vial. It is not the same anymore. It's a very simple vial. It involves the student expectorating a little bit into it, very easy for a parent to support. So who has to be tested? The testing has to be random. But until the testing is required by New York State for us to stay open, until they designate us a zone, we are going to start with the testing, and we're going to start by asking people to volunteer. Do you volunteer to do this testing until we are mandated by the state? Once the state mandates that we have to do the testing, then I need to know if you're going to opt your child out and keep your child home, if you're not going to agree to send me in a little bit of saliva. And remember, the company does not have your child's information. We are the only people who know what vial is connected to what child. They do at Miramis pool testing. And when they get a pool of saliva and they realize that there is, it's COVID positive within that pool, they then separate that pool back out. They take the original samples and they do them in groups of 2. This is why we're selecting Miramis. In the end, I am going to know that out of these 2 people, one of them has COVID. It's not a case where we're going to have to say, okay, all 18 people who were in that group, in that pool, you all have to be retested. And because that's cumbersome for families, it sets everybody on high alert. We don't want that. We want to know I'm one of 2 people who may have tested positive for COVID. They're going to take my saliva and they're going to run it through for an additional test to see who it is. So when do we start with this? I think we start January 6th. I think we hand out vials when we get back on January 4th, provided contracts go through with the Board of Education, and then we start collecting so that we start to get used to this. So you may say, Jen Lamia, why do you care to start this testing if we're not required yet? For 2 reasons. First of all, I want to get a little bit of surveillance testing to make sure that what we think we're seeing is accurate. Second, I want to be involved in a company like Miramis, who is going to be on the cutting edge of receiving and distributing those self-administered PCR tests to be done at home. I hope that one day, perhaps in February, when tests are available and they are, within our financial reach, and we may have to go out and seek donors for this help. I hope that a day exists where every child gets up on Monday morning and every adult and takes their rapid PCR test at home and says, okay, I'm COVID negative. I'm going to school. I'm going to work. Or, wow, I'm COVID positive. I have to stay home. And since it's Monday morning and 48 hours have elapsed, people in their classes do not have to be quarantined. I think that's our best mitigation strategy from now until the time that we start getting vaccines, which I'm not really anticipating until April, May, or June for our population, after they go through essential workers and the elderly, et cetera. So my proposal to the board, which will be on Tuesday's agenda, will be to contract with Miramis for these test kits to be used when needed. We can renew the contract with Miramis. They said that after this contract's complete, we can just keep doing rollovers of it, until which time we may be able to work with them on a rapid PCR home self-administered test for everyone. December, we're going to wait for the need to test students and staff as per the DOH. So we are not going to be doing this testing in December, but January 6th, we hope to begin this surveillance testing process of a random 20% who, if we're not in a zone, have agreed to be a part of this saliva testing. So our process is board approval of the contract, notification to the staff and parents, including electronic consent forms. I'm doing the superintendent coffee today and faculty meetings. I'll do some more Q&A sessions as the weeks go on. Identify cohorts randomly for testing, and identify some volunteers we may need to coordinate some of these kits for distribution, which is how we're making it affordable to the district right now. So our current goals are to establish this contract with a reputable testing company. Miramis, by the way, does all of the saliva testing for the Wellesley Public Schools in Massachusetts, which is over 5,000 students. They do many private schools in our area. Bob Shaps and I from Amerenac will be the first public schools to be getting on board with this company. We want to continue to monitor our attendance and our COVID-19 numbers. And what seems like a really promising future, right now my life consists of being excited about this, but waiting for those self-administered rapid PCR tests every week to really know that every Monday morning we have a healthy snapshot coming into the schools, and then the COVID-19 vaccine, and to see reductions in numbers and consider school plans eventually to bring back students in the upper grades, being our final goal. So Board of Ed adoption, establish the timeline for the testing, notify the public, the Q&A sessions, collecting consent forms, distributing these tests, and 7, a big hope for speedy and efficient rapid PCR self-administered tests and vaccines for all. That would be my holiday wish for our school community. That was a lot of talking at you. I want to take some time to see if anybody has any questions. Do the kids stay home while waiting for the saliva results? No, they do not. Will vaccines be mandatory when available? I don't know if they will be mandatory. That's going to be a New York State Department of Health or even a federal kind of decision. about schools. Like, we don't mandate the vaccines that you have to have done right now. That's a Department of Health function. I don't know. I mean, I would assume yes, but I don't know. If we're moved to a yellow-orange zone and our child is one of the random selection to be tested on a given week, but we refuse the test, what are our options for attending school? So they haven't given us guidance on that yet. My assumption would be that if you are not going to take the test, that you would go to a remote function if they're saying that a random 10% testing has to be done. Now, I have to say that they are not doing things with much precision at the Department of Health. So I'm not sure if, we're not just testing 10%. We're going to test over 10% because there's a certain amount you're not going to get back. So I think there's a little wiggle room there, and we're going to have to work that out with the Department of Health. I'm not sure how stringent they're going to be. Any other questions? So that's what I've been doing with my time, folks. How about you? Everybody doing well? I think that the goal is just to take us from here to there in as safe of a way as we can. Oh, thank you. Thanks for nice words. Oh, good. Great. We have a Miramis user on this site. Thank you, Anne. Yeah, they are terrific. All right. I'll wait a couple seconds to see if there are other questions in the chat, but I think by now we have established that whether it's me, Tim Kaltenecker, or Gina Cunningham at the district office, or any one of our administrators, we're available, right? And we don't want you as a parent. We know you're doing this parenting for the first time. Well, maybe the second time, depending on your life situation, but you're doing this parenting thing for the first time, essentially. And I've done this parenting thing. I have a 19 and a 20-year-old, but I've watched the parenting thing for 30 years. If you're struggling with anything, call the administrators, call me, send me an email. Let's have private conversations. We are a small enough community. We will help you workshop anything that you're struggling with or going through. Nothing is too small. So please let us know by all means. Oh, wow. What nice comments. Thanks, everyone.
Jen, there was a question here. What happens to the samples after the students are tested?
They are disposed of after the students are tested. The company has to keep them for certain, I think it's 90 days, and then they dispose of them. When you said the test will have a pair, does your child need to stay home while you wait for the second test? Yes. Yes. That would just be like you're treating your child like a contact. But we're expecting these tests. This is right in Brooklyn, and they have the manpower to be processing this. We're driving our tests over there to even expedite it and not wait for overnight delivery. So I would assume that would be a very short window. How close are we to yellow? Well, I know from being on the president's board of Northern Westchester Hospital that Northern Westchester is functioning as normal right now. They have like one patient in ICU with a COVID case, and I think something like 23 patients in Northern Westchester Hospital with COVID. Those are not huge numbers for our area. I don't know that we should be anticipating being in a zone. I think it's going to be they may do a county-wide, but I'm doubtful. On Monday, after talking to George Latimer, I actually thought we were going to be slipping into a yellow zone as an entire county. But I found from the governor, no, his main goal is to keep everyone in school. So I'm not thinking anybody's trying to pull the trigger quickly on that. And our numbers really are, knock wood, low right now. All right. How accurate is the saliva PCR test? We're hearing 97% accuracy. If the school has kids' information, but testing facility doesn't, can we have a code on the vial so the school can trace it back to the student? Yeah, that's what we're doing. So our technology department is helping us with that. We're basically QR coding all of these vials using our nurse, Julie Gallagher at the high school, who, if you have any interactions with Julie, who's also an EMT, she's like super brilliant. She's going to be running that operation with our physical trainer, Dan Santoro. And they're going to be connecting these QR codes to each vial. So only Julie Gallagher will know what vial is connected to what student or what staff member. Yes, that's our goal, is to avoid the quarantine of the other 18 that are going to be in that pool by getting it down to just the 2 in the end. And great. All right. Am I missing any questions? I tried to do some Evelyn Wood speed reading.
I don't think so.
I think everybody on this call is too young to know who Evelyn Wood is. Tim, do you know who that was?
That was a name I haven't thought of in a long time.
Yeah, there used to be this person who taught speed reading. You know, this was the days before the interweb, named Evelyn Wood, and you could read faster.
Yeah, there was a machine you would practice on.
A machine? I don't remember that much. Oh, God. All right.
We're dating ourselves.
We are.
Very nice comments.
And we're aging, you know, ourselves. Thank you so much for these comments, everyone.
And Jen, if I can just again thank the hard work of our administrative team and our teachers from the spring over the summer to now to get to this place. It was just endless work, and we thank the families for their feedback that we really took to heart, and thank our teachers for working with us and everybody working together to get to where we are. Thank you.
We have a question for the at-home PCR test, the one that I'm hoping for. That's going to be like my birthday present. Is the goal to have every family who wants it test every week, or just the 10, 20%? No. Depending upon how expensive that test is, I want every single person, if they're willing, to take it before they come into school on Monday. It's at home, it's yours, it's in your possession. It saves anybody from quarantining if you come in. So that would be my goal. Now that's going to require some funding. So we may have to go out to the community and see if we could get some support for that. I'm not sure what the prices of that will be, but that's my goal. I think I'm going to ask everyone to start buying lottery tickets and donate your lottery proceedings to at-home PCR tests to please your superintendent. Kids are loving being in school. Yay, me too.
Jen, there's a question that is the test just for kids, not parents?
Oh, the testing is just for kids. Yeah. Parents, you're on your own. Oh, that's such a nice message.
Yeah, and there was a question about the timing of the at-home tests that I think you missed.
Oh,
when are they expecting?
timing? So when we're expecting them, since they were just FDA approved on the Jen Lamia calendar with no support or backing of the validity of this, I would hope that we are going to start to see them emerging on the market in January. And I'm hoping that by early February, they may be into the hands of these companies and affordable for schools. What's our best way to show appreciation to all of the staff? You know, custodial staff, so nice. Yes. I think there are two things that have kept me happily married for close to 25 years. One is good food in my house at all times, and the other is a personal touch, right? So right now, I know that my husband's in the floral business, but I do get flowers every single week throughout COVID. I know that I get handwritten notes all the time. Handwritten notes are beautiful. It's really, you know, just receiving a card. I was outside of Coman Hill and on the Wednesday before Thanksgiving, and somebody gave me just a handwritten card, and I got it on my desk. I'm so happy. I think that that's a great way to show your appreciation. And I think, you know, patience and talking to the teachers and telling them what you need is also great. And how long is the plan to keep doing the at-home PCR test? It will be ongoing routine for the foreseeable future. It's going to, I would say, the at-home PCR tests until we feel like we're just not seeing the cases anymore. They would be effective, or until which time we feel that the vaccine has had a scientifically calculated amount of time to have impacted our public community. That is not going to be dependent on me. I think that's going to be dependent upon my conversations with Dr. Casaro, Richard Stumacher. We have such amazing doctors who are giving of themselves. Thomas Murray from Yale New Haven Children's Hospital and Pediatric Infectious Disease. I mean, all of these people help me to weigh in on these decisions. I feel like I can't make them on my own. Remember, I'm a doctor of letters. I can fix your commas. I can't fix your health. Yeah. All right. Is there any discussion of a plan for all local districts to join together to contract with a company to get a better contracted price? Well, I have to say that your superintendent already hardly negotiated those prices, and we got a better price. And joining in with Bob Shaps over at Mamaroneck helped us set those rates, which are not rates which are going to be offered to any other schools who are picking up Miramis after this. But I have to say, we are very, very fortunate in this community that the board is looking to do this privately for the sake of the yellow, red, and orange zones. The hardship that this causes in other districts to try to facilitate those free tests, the amount of staffing, and also just the uncomfortable factor. If I had a 5-year-old, I would not want to know, and I know you like me, but if I were a parent, I would not want Jen Lamia swabbing the nose of a 5-year-old, like an anterior nasal swab. Like, I don't want anybody doing that to my kid. So in this community, we're able to get that support from the Board of Education and the community. So many other districts simply cannot. I think it's a distinguishing factor of who can do it and who can't. I also know Scarsdale's looking into saliva testing also, but they're looking at a different company. There's no way that we're going to get a better rate than we're getting on what we're doing right now. I mean, it actually costs us, when I looked at a neighboring school district who hired a company to come in and facilitate the free tests from the state, we are $1 more per test than they are. And they are doing all of the manpower and training people and exposing the kids to the nasal swabs for $1 less than what we're doing for this PCR saliva testing. So if that gives you any parameter without sharing cost. It was a good question. With you, Megan Mass, I'll volunteer to help when Dr. Lamia gets her birthday present. Great. All right. I would love that. Dr. Lamia's birthday present. My birthday's January 6th. I would like, please, to have, 2,700 times however many at-home PCR tests in a box in my office. That would be like a beautiful gift for all of us. I'll share with the whole community. All right. Any other questions? All right. Well, you know where to find us. I'll still be in this chair tonight and tomorrow. So feel free to send emails. Thank you so much to Dave Mack, Peggy on this call right now, Jeannie Marie, Mary Beth. I know Jill was on this call. Of course, Gina Cunningham and Tim, who every time you see anything related to COVID, just know that that was about 6 hours of Gina Cunningham and our AP and principal's time. But we're doing this and we hope to continue to do this. Your kids are wonderful. Our community is wonderful. And there's no better place to be doing it. Thank you, Mia, on our Board of Ed. Yay, Mia. I don't know if we have any other Board of Ed members on here, but Mia definitely didn't sign up for a full-time non-paying job, which is what she got. Thank you, Mia. Will Coleman Hill continue half days Wednesdays indefinitely? I think we're going to try to keep the same schedule we have right now. I mean, if there's suddenly some sort of miracle and we're all back in school, that's one thing. But the teachers have really been utilizing that time to work with their teacher aides and their other teachers in other classes to get those platforms that they're using for these kids. Just to confirm, rate of testing will be once a week. Yeah, I'm looking right now, starting January 6th, 10% a week. And that's of students and staff. Let me know if I'm missing any questions here, anybody. All right, folks, everybody have a great rest of your day. Send us any questions you have. Enjoy and love your kids. Thank you for trusting them with us. Take care, everybody.